Now, the spinal nerves, they basically come out of the particular spinal corresponding segment, and then they're going to innervate the particular areas depending upon which particular area or which particular muscle or which particular effector organ or target organ they're going to innervate. Now, when we talk about these spinal nerves, we must know that we went through the details of the fact that this is the dorsal root ganglion that we were talking about. And then we have an anterior rami, and then we have a posterior rami. And these particular anterior and posterior rami, they're going to communicate, as well as we have to keep in mind the fact that they're carrying the sensations, and as well as they are carrying the motor neurons as well as the sensory neurons along with them, and they're going to combine together, and they're going to form a mixed nerve, which is known as a spinal nerve out of them. Now, when we get into the details of the sections of the spinal cord, we must know that there are these corresponding spinal nerves that are coming out of these particular sections. For instance, we have the cervical spinal nerves. Mainly, we have the thoracic spinal nerves. And then, of course, from the lumbar segment, we have the lumbar spinal nerves that are basically proceeding down, and then moving on, we have the sacral segment of the spinal nerves accordingly. Now, talking about the conus medullaris, basically it is basically where the extension of the pyometer, it basically ends, which is known as the phylum terminale. And out of that particular segment, there is this sheathing of the sensory and the motor nerves. It's basically sheathing out, and they are present at the dorsal, or they are present at the inferior end of the spinal cord, and this is known as the this is known as the chorda aquina. Now, this chorda aquina basically originates at the point of conus medullaris, and it's basically the point where the spinal cord, it basically descends down and it is terminated. And this point is basically known as the conus medullaris. And then we have the chorda aquina, which is basically associated with this particular point of conus medullaris. Chorda aquina is containing the motor as well as the sensory nerve roots along with them. What is phylum terminale? It's basically an elongation of the pyometer and gets attached to the posterior surface of the coccyx. So these are some of the terminologies that you have to remember. Now, mainly we have the cervical plexus, which is being formed by the contribution from the cervical segments of the spinal cord, namely the C1 to C5 segments contribute towards it. Then we have the brachial plexus, where the contribution is mainly from the C6, C7, C8, and T1. The lumbar plexus is again being contributed by the segments from L1 to L5, and then we have the sacral plexus, which is being contributed by the segments from the S1 to S5. Again, you must remember that we studied about the enlargements of the spinal cord, and that were due to this multiple innervations, or the amount of innervations at that particular level, that is going to determine this maintenance of this particular enlargements in the spinal cord. This is the lumbar plexus, and then it is also mentioning the sacral plexus being contributed by the S1 to S5 segments. Now, one must remember that how a spinal nerve is being formed. First of all, we have a dorsal root, which is coming out of the dorsal horn of the gray matter, and the ventral root, which is coming out of the ventral horn of the gray matter. And they're all combining to form the spinal nerve. The ventral root is, or the anterior root is basically carrying the sensory nerves, and the dorsal root is carrying the motor nerves, and they're all basically joined together. So it basically forms a mixed nerve, which is called as a spinal nerve out here. Now, this spinal nerve basically divides into a dorsal ramus and a ventral ramus, and is going to basically innervate the muscles accordingly. And then we have the white rami, or the rami communicanti, in between. This is the gray rami, and then we have the white rami in between, which are basically self-innervating the spinal cord as well. And the muscles that are basically being attached to the spinal cord, they're being innervated by these particular rami. Now, this is again one of the examples how at the level of the thoracic spine, there is the innervation, or there is this dorsal rami, which is basically innervating the muscles of the back, and then we have the ventral rami, which is coming out of the ventral root. And then this is the sympathetic chain ganglion, which is basically running laterally to the spinal cord, and it runs throughout the vertebral column and is present out there, and is basically going to provide the sympathetic chain out there and innervating or providing the sympathetic nervous system a particular getaway. Then we have the dorsal root ganglion, and these are the rami communicantes in between. This is basically the spinal nerve, which is giving way to the dorsal ramus and to the ventral ramus. Now, the ventral ramus again gives rise to a particular nerve, which is going to innervate a set of muscles. For instance, over here, this ventral ramus is continuing into an intercostal nerve, which is basically innervating the muscles of the intercostal muscles in between the ribs. And then this intercostal nerve is being subdivided into two nerves, for instance, the lateral cutaneous and anterior cutaneous, depending upon the particular set of muscles that it is going to innervate. So this is how the innervation takes place. A single mixed spinal nerve, it basically subdivides, and then it gives rise or continues as a single nerve, and then there are the subdivisions to that particular nerve as well. So these are the lateral cutaneous over here, and the anterior cutaneous are basically the branches of the intercostal nerve. Now, this is again to reinforce what we have learned. We learned that basically there is this ventral root and a dorsal root, which basically gives rise to a spinal nerve. And when the spinal nerve comes out, it gives rise to a dorsal ramus, and then we have a ventral ramus. And further on, obviously, these rami are going to continue as particular nerves depending upon which set of muscles or which set of target organs they're going to innervate. So this is basically the general organization of the spinal root, and how can we calculate that which particular spinal root comes out of a particular column of the spinal cord.